Good evening, ladies and gentlemen. Good afternoon, good morning, good day, and welcome to this live stream. My name is Param, and thank you for joining in. And today, a little bit later, we had some technical difficulties around the globe. It is as it happens, technical difficulties do happen, and the technology is such that we can always, have issues with the technology. And today, welcome you wherever you're listening this, watching this feed from, wherever you are, which country. Do let us know, because it's always good to know who's watching us from whereabouts in which part of the world. Well, my name is Param, and if you happen to bump into this page, I'd like to welcome you. Please do subscribe to my page over here. It's actually called Fiji Indian TV, where we try to reach out to all the Fijians around the globe. And today we've got a wonderful topic, and the topic is it's going to be in English, and it's all about COVID. And I've got two lovely gentlemen actually joining in today. And look, when did COVID start? On February the 11th, 2020, the International Committee on Taxonomy of Viruses adopted the official name Severe Acute Respiratory Syndrome Coronavirus SARS version 2. Now, what is its origin? There's a lot of hoo-ha about it, where it all started from. What is the origin of COVID-19, Severe Acute Respiratory Syndrome Coronavirus, hence known as SARS-CoV-2? Is a novel Severe Acute Respiratory Syndrome coronavirus. It was first isolated from 3 people with pneumonia, connected to the cluster of acute respiratory illness cases in Wuhan. And of course, as you all know, it all started in 2019. All structural features of the novel SARS coronavirus 2 virus particle occur in related coronaviruses in future. So what are the variants? There's lots of variants out there. The alpha, the beta, the gamma, the delta variants are all considered variants of concern by the World Health Organization. While the Delta variant of the coronavirus has quickly become the dominant strain in the United States, it is not the only variant. Note, it is not the only variant circulating in the population. The Lambda variant, first identified in Peru, is also making headlines as it has started to identify in several states. Houston Methodist Hospital reported its first case of the variant this week. Methodist Hospital reported its first case this week, and it's now looking back, looks like. Dr. Stuart Ray is a professor of medicine at the St. Johns Hopkins Hospital in USA. He says, while there has been clear head-to-head data, the evidence so far do not suggest the Lambda variant has any great advantage over the Delta variant. Delta is clearly dominating right now, and so I think our focus will remain on Delta as a hallmark of highly infectious variant. And as I mentioned today, that I've got 2 wonderful gentlemen accompanying me on this coronavirus issue around the globe in your country. What's happening? I have with me Mr. Ashok Muni, who's a lab administrator, educator on NCDs, and an advocate for preventative health and maintenance. And he owns a pathology lab in Fiji, currently running, and it's called Smart Lab. And with me also joining is Mr. Dr. Narayan, who is a retired Director of Clinical Laboratory Pathology, Nuclear Medicine, Radiology and Radiation Oncology, retired from Seton Medical Center in California. So, ladies and gentlemen, I would like to welcome them, the both wonderful looking gentlemen, in today's feed. And here we go. Gentlemen, welcome to the program. And how are you two today?
Thank you.
Thank you. So on my up here is Mr. Ashok Muni, who is, I can see up here, and on here is, now both of them are uncle, but I'm addressing them as Mr., or I'll call them by the name, and it's Ashok Muni from USA also, and USA and California, and Mr. Dr. J. Narayan, who's also from USA. How are you two gentlemen? You're looking fabulous, both of you.
Thank you. After trying to solve the technology issue,
yes,
all my fault. That delayed the program. But anyway, I want to thank you very much, Param, for having us, and would like to have dialogue with the audience about the coronavirus too.
Hmm. Now
And before,
let's start the program by a little bit about yourself. I'll start with Ashok since he's on my left. Who you are and where you are from, sir, and a little bit about you.
Thank you, Param, and thank you for the opportunity. Uh, I'm Ashok Muni, born and bred in Fiji,
Hmm.
and uh, I migrated to the United States in the mid 70s, 1970s, and have had varied occupations. For the last 20 years, I've been working for hospital and private labs in California, and has and have uh, created this has created an interest in me in preventive health, and I started Smart Lives Fiji 5 years ago. Came to Fiji to do preventive screenings to identify people with asymptomatic people with risks that they may be carrying and not being aware of. And that way, I would be able to then guide them into what the next actions would be.
Lovely.
And before I left Fiji for my own medicals here in the US, and I got caught with the COVID, um, I have been trying to, we did almost 6,000 people in the Fiji Islands at my cost. So it was gratis to the people, and it was a give back to the country of my birth, Fiji.
So on my right, I have Dr. Narayan. Sir, I'd like to welcome you to the program and your introduction, please.
yeah, and was born in Fiji as well, a small village called Nawaka, about Beck Road, Nandi, about 3 miles from Nandi town. And I finished grammar school, and then my family put me in sugarcane farming, and I didn't particularly like doing that. And I did few odd jobs while trying to figure out what to do with my life. In 1957, February 14, 1957, I got hold of 113 pounds and bought a ticket on a ship, yes, or Sova, to arrive
113
here.
pounds, eh?
Yeah, that's all the ticket was, and that's all the money I had. And I came over. I was in Berkeley, went to an adult high school 2.5 years, and then junior college, and then San Francisco State University. And I met my wife, who is a Greek lady, and we've been married for over 60 years. Two wonderful daughters and three granddaughters. I'm very proud to say one of my granddaughters is doing a medical residency at Johns Hopkins Hospital. Three
Okay.
more years to go. I started to work at Kaiser Foundation Hospital, got a license in medical clinical laboratory scientist and medical technology from American Society of Clinical Pathologists. And while I was working full time, I did my master's in science and master's in management, and I did a doctorate, PhD. And one of the things that Ashok said, very interested in disease management and preventative care. And I created the documents and so forth. So, retired now from Seton Medical Center after working for 30 years, and I've been in retired mode for 14 years. And I've just completed a book about Fiji Island, from India to Fiji to America, and it's all
So,
about my mama Changi.
okay, we will come back one day and obviously talk to you about your book, and I'm sure it's got fabulous stories around it. Now,
Right.
let's get into the major topic of this today, and that is oh, by the way, everybody that is watching us around the globe, I'd like to welcome you. And any families and friends, if you've got any issues, you could just type in the feed how to share this feed amongst your family and friends. Just click on it and send them in Messenger. It's worldwide. They don't have to be my friend or anybody's friend. they can actually watch this feed. So, friends and families of Ashok and friends and families of Dr. Narayan. So that's welcome. So we welcome you to this forum. And if you've got any questions, we leave the questions to the later part of the program, where both of the gentlemen would be talking about it. Now, on my upper side here is Mr. Ashok, who's will be asking him questions about in mixing the questions in regards to his setup of the pathology, the running of the test, whereas Dr. J. Narayan is going to introduce and tell us a little bit about the origination of corona, where it is going, what we're doing, and all so forth. So, Dr. Janet Ryan, I'll give the board to you, and an introduction on my first question to you would be roughly, let's give you an overview as to what coronavirus is and where did it originate from.
Yeah, actually, before going there, I want to say this loud and clear, that COVID-19 global lockdown resulted in one of the greatest economic catastrophe in history. This is all due to COVID-19.
Mm-hmm.
And COVID-19 is a coronavirus family of viruses that cause illness such as common cold, severe acute respiratory syndrome, known as SARS, and Middle East respiratory syndrome, known as MERS. In 2019, that's why COVID-19 is called COVID-19, because what in 2019 was identified as the cause of disease outbreak that originated in, like you said earlier, Wuhan, China. The virus is now known as severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2. The disease is caused for coronavirus 2019. In March 2020, the World Health Organization, WHO, declared COVID-19 outbreak pandemic. That differentiates between endemic. Pandemic, as you know, means worldwide. Endemic is localized. Public health groups include U.S. Centers for Disease Control and Prevention, known as CDC. A lot of information can be gathered from that organization. And WHO are monitoring the pandemic and posting updates on their websites. So it's readily available to anybody that wishes to find more information. I use Mayo Clinic for my references. I use WebMD for my references. And you find very common symptoms. When someone is infected with the virus pandemic, it takes 2 to 14 days after the exposure where symptoms start to show up. What are these symptoms? Fever, cough, tiredness. These are early symptoms of COVID-19. And then one can have shortness of breath or difficulty breathing, muscle aches, chills, sore throats, etc., etc. One needs to differentiate between COVID-19 symptoms versus
common cold.
Flu virus.
Yes.
Again, these are respiratory conditions.
Mm-hmm.
And there are a number of other conditions that are involved, and I can't find it right now. So the list is not inclusive. Children have similar symptoms to adults. Generally, have mild illness. The severity of COVID-19 symptoms can range from very mild to severe. Some people may have only a few symptoms, and some people may have no symptoms at all, such as worsened shortness of breath and pneumonia about a week after symptoms start. So COVID-19 can be very serious, especially in the elderly population, 60 and over. What are those? Serious heart disease, such as heart failure, coronary artery disease, or cardiomyopathy.
So, in other words, people in Fiji or any other country that are saying that a person has died of a heart attack, and also the person could say, or the coroner's report or the report could say the person has died of COVID. Now, I think there's a misinterpretation, as the doctor has pointed out, that these are the conditions that is coupled with infection of COVID. So, due to COVID, they could die of severe heart attack. So, I think people should not differentiate. Or, in other words, that's a lovely way of putting it through, Dr. J, that people die of heart attack. I think it's a good information for the people out there. Thank you.
Yes, I was reading this morning about Fiji, and Dr. Fong, is it, who
Yeah, Dr.
said,
Fong. Yeah.
yeah, a very young person, like 11 months old, that passed away from COVID.
Mm.
I wonder how they came to their conclusion, but anyway, that's what they said. And it was followed up by another doctor that said that Fiji is having a real challenge with COVID-19.
Mm-hmm.
And I can imagine being raised in a village. Both sides was a Fijian village. As you leave Nandi, coming to Nawaka village, you pass Nawaka village, native
Mm-hmm.
Fijians live, and then you have Patatu village, and our home was right there in the middle. And I can see how challenging it would be for Fiji medical community to try to manage COVID-19
Mm-hmm.
and to do the testing and so forth. And I'll go later on to talk about the two type of tests that is widely used here
Mm-hmm.
in states.
Mm-hmm. So, what
Uh,
are they using in states at the moment?
the specimen is from nasal
Swab.
chamber, and they take the specimen from there. And actually, I was at the hospital today doing my eye checkup, and
Mm-hmm.
I went to the area they do the testing, and I asked the folks,
Mm-hmm.
and they were kind of surprised that I knew a little bit about how to test what's called PCR,
Mm-hmm.
polymerase chain reaction test, as
Mhm.
well as so that would be the antibody test, and then we have the antigen test.
Mm-hmm.
Antigen meaning the virus itself
The
can
Mhm.
be
virus
tested.
load.
Yeah,
Mhm.
virus load,
So
exactly.
that's done from the
Uh,
blood.
yeah, it can be from the blood, but it also can be from the
Swab.
wherever the virus
The swabs.
is comfortable, and most of them are in the nasopharynx
Mm-hmm.
areas.
Mm-hmm.
But blood testing is certainly there. In fact, I set up the PCR technology
Mm-hmm.
15 years ago.
And Ashok, in Fiji, they have a rapid testing at the moment for COVID.
I don't think we are doing that right now. The
Hmm.
rapid testing is a qualitative test, and that is only specific for proteins on the surface of the
Okay.
virus.
Okay.
Uh, and I think the CWM
Hmm.
and the Tuomi Hospital in Tamavua are using PCR.
Okay. Okay. Okay.
Uh,
So
and I think one of the problems with the rapid testing is the FDA did not quite
approve
okay
it.
that.
Okay.
Yeah, and the reason being
Hmm.
that they were not able to get okay, they were not satisfied that the specimens coming from nostrils and our throat and our saliva,
Hmm.
and the results were not giving a very good result.
Wasn't very
And
conclusive.
yeah, and the reason being that if the FDA had tested through
Mm-hmm.
and okayed it and approved it,
Mm-hmm.
then it would add credibility to the results.
Okay.
As it is, I think the companies that were making up this rapid test
Hmm.
kind of jumped the gun.
Okay.
They
Okay.
jumped the gun, and that's the reason why the FDA was not able to approve that.
Hmm.
And now, having said that, I can also say
Hmm.
that the qualitative test it's an indication that there is,
Some sort of
uh,
virus available.
yeah, the proteins are present on the virus. Okay,
Okay.
so it has to be determined and conclusively done only by PCR tests.
Okay. Okay. Got it. Got it. Great. Thank you for that info. And go ahead, Dr. Jay. And you were proceeding with the United States. They have like a viral load test, which is a blood test, and then you've got the PCR test. Are you saying?
Going from the exposure, one of the things that everyone is having challenge now is still trying to enforce the distancing between people and masking and again, I go back because I am over 60. I'm very concerned about being exposed.
Mm.
And recently, a couple of hobbies that I had, I used to raise bees and make my own honey. And I have also, I started to play golf, and I was a pretty good golfer. I belonged to a group of men called Sons in Retirement in California. And I went to the leadership and organized a group. And one of the things that I was interested in was golf. But anyway, testing is significant, but I think people need to take responsibility to be able to make certain that they remain safe. And wearing mask is absolutely a must. For example, we think respiratory ailments are in the air, sneezing, coughing, and so forth. But they also are found to be on the surfaces of the items that you touch. So a person who is just rubbed his nose and opens the door, you just introduce the virus on the knob. And so you have to be very careful to wash your hands.
So in
Another
other words,
very
if you go into a shopping center and if you're looking at all these bananas and all those oranges, and people got a habit of say avocado, you pick up an
Touching.
avocado, so you're touching things, and then you're touching your nose or
Yeah.
so forth, because you cannot be sanitizing your hand every single moment when you're touching 10 fruits. So it's kind of very risky, because as soon as you enter the shopping center, you're only sanitizing your hand, but after that you're touching your nose. What happens that? Or any for that matter, if you are carrying the disease, even though you've got a mask on, it would perhaps be on your clothes as well. When if you rub
Yes.
the arm, for example, or if you've got a
exactly.
fruit, you'd like to rub it on you, so that's transferred it anyway.
Yeah, there's no
Yes.
question about it. So you have to be very concerned about the surface because there's so much emphasis on wearing a mask, right?
Mask, true.
But yeah, you can do that, and you should do that. Everybody should do that. I actually am very, very aware of how to prevent myself from catching the virus, and you can catch it while you are still vaccinated.
Okay.
And the two terms they use about vaccination is called fully vaccinated versus J&J vaccine
One.
as compared to Pfizer vaccine or what's the other one?
Moderna.
I'm
Moderna.
forgetting. Yeah, yeah. And you need two shots, and at least 2 weeks apart. And so I am fully vaccinated and I feel very comfortable, but I'm still very concerned because I go 24-hour fitness 3 times a week, and I'm with this crowd, and
Yes, yes, yes.
for a guy who's 80, going on 83, I feel
Wow.
like I got to protect myself. You know what I mean? The exposure, and because it takes 2 to 14 days for the symptoms to appear, can you imagine on the third day or fourth day you are walking around and infected people all around you, right?
It's too late by then, isn't it?
Yeah.
Yeah, yeah, and so it's very important. So exposure, fever, cough, shortness of breath, other symptoms, fatigue, tiredness. Some of these are included in just mere the way our lifestyle is. But it's important. The symptoms, as I mentioned earlier, very similar to flu. So we have to figure out how to separate the two.
True,
And one
very
of the
true.
ways is to test. Uh, um,
Yes, go ahead,
Can I
Ashok.
add? Okay. I wanted to add something. It is interesting. that the virus will stay alive on our clothes for just a couple of days, but it will stay alive on surface like plastic or metal for 7 days. So, if you have just touched a doorknob, for example, if that had the virus on it, then it will stay there for 7 days. Whereas on our clothes, it's 2 days maximum. Uh, so it's very important. And I'd like to add on Uncle's assertions that keeping our hands clean, washing or using disinfectant is very, very important.
We're dealing with
This-
such a vast a type of thing that we've never been used to. Because if you look at it, it stays on clothes, it stays on your hands, and plastic bags in shopping centers. So basically, it's everywhere. It's everywhere to
and you,
get you.
and you know that if someone who is a carrier, if that carrier sneezes, you know how many droplets are out there
Yes,
in the
of
air
course. Yes.
suspended.
Yeah.
And then if I'm walking through that without a mask, I'm going to inhale it. And
Blast.
it's the easiest thing. And my mucus inside my nostrils is going to be a wonderful host. And we know that this virus is neither dead nor alive until it finds a host.
Yes,
So
that's
if
true.
it goes into our nose and finds a host, man, you got something going. Now, if
Yes.
we were to swallow that
Yes.
inside and it goes into our stomach, the stomach acids are going to kill it.
Okay.
But, but if
The
it goes
lungs.
into our lungs,
Yes.
there is no way of fighting it.
Yes. Now, Uncle, just reiterating on Dr. Jai's comment, the group that I at risk over there, and I've just put a little slide on the screen. It's primarily the elderly people, and primarily all your families and friends. So your mom and dad that you're going to visit in a nursing home, or on a day-to-day basis. Anybody, as Doctor has pointed out, over the age of 60 is a prime contender for catching the virus, and henceforth dying from it from other causes such as heart attack or lung condition, etc. But see, people think they'll go home, that they are fit, physically fit, and they will actually overcome this. I mean, a lot of people are overcoming, but they are trailing conditions with it. So the group at risk are there as well. So just a little pointers out there as Doctor proceeds with his information on coronavirus. So go ahead, Jay.
Yeah, I was gonna talk a little bit about the symptoms that once you are exposed to the virus.
Yep.
Fever is, of course, very common. Cough, shortness of breath. Other symptoms may include, like I mentioned, fatigue, nasal congestion, and so forth. Some of these symptoms also appear when you have, like I said, other kinds of, and there are 10 or 15 different kinds of vaccination for different virus in different kind of condition. What is it a person who thinks he's got the virus? Well, you got to have it clarified.
Yes.
You say stay home, since most people get mild form of illness but do not visit public areas. I'm not sure I agree with that. I think that if you have the virus, you need to find out. If you have coughing and sneezing and little fever and so, you need to find out. You need to call your doctor, get your family physician, and stay in touch with your doctor. Call your doctor before going to him. It's very important. Call the doctor, talk to somebody in the office before going,
Okay.
because
Okay.
you don't want to infect anybody else.
Yes.
A healthcare provider or area hospital near yourself. Avoid public transportation, ride sharing or taxi. So you say, how do I get there? Well, you gotta go with one of the family members, hopefully. Avoid public transportation. Stay away from others. Cover your cough and sneeze. Immediately wash your hands. Clean your hands often, and I mean often. Like I said earlier, when you touch a surface that may be contaminated, you don't know. And that's the challenge.
And as
When I
yes. And has,
No,
accordingly, as Dr. Jay has pointed out, there's a slide on the screen as well. If you got a temperature, if you got all those conditions, you put up a mask on, you sanitize yourself, and before you, in the last resort here is to ring your doctor. On the screen there, you can see there's a slide there. Ring your doctor, and then after the doctor says, then you have to take precautions. How are you going to go to the doctor? And if the cases are such that you are going to travel with a family member or friends, in Fiji, mein to, they surround your place
Right.
with a tape so that nobody that they know that it's a containment zone and you do not enter the zone at the moment. So they have stopped doing that now in Fiji. So what they're doing now is basically telling them, if you've got the symptoms, stay home, and they're not
Yeah.
even testing them because it's going to be quite expensive. So moving forward onto that the symptoms. Now let's move on to the managing the sickness. Dr. Narayan, how is one going to manage the sickness if someone tells you to stay home?
Mm.
Jay?
well, as I made a note of that. It says,
Mm-hmm.
stay home since most people get mild form of illness.
Mm.
It may or may not be true. I think of in a village life. Everybody is trying to make a living, and it's very challenging to do that.
Mm.
And so when you are staying home, sneezing or coughing a little, fever, you
Mm-hmm.
kind of ignore those things. But you can't ignore for too long.
Yes.
After the second, third, fourth, fifth days, you gotta figure out what's going on, and you gotta call your physician, and then
Mm.
of course figure out how to go there. And,
Mm.
transportation used to be an issue. Maybe they have a bus right now. I don't know.
Mm.
Uh, uh, Taking a taxi, you barely make enough money to
Mm.
go day by day. I
Mm.
remember carrying lunch, waking up 3 in the morning to go plow the field. And
Mm. Mm.
it's very challenging. So number, I made a point here about monitor your symptoms. Common symptoms of COVID includes fever and cough. We went over that. Trouble
Mm.
breathing. More
Mm.
serious, they seek medical attention. So whenever you have trouble breathing, and aging process is there,
Mm.
your lungs are not necessarily clean. It's not your fault because
Mm.
of the air pollution. The
Very true.
alveoli in the lungs are
Yeah.
already congested. It's a real challenge, I think,
So if
for
in a
people.
country like India, where the air country or near the third world, the air is so polluted, then you've got
Mm.
also this in Fiji. I think there's a lot of pollution as well due to those diesel cars and buses.
Yes,
And
yes, yes.
yes, I think now the LTA is form some sort of a monitoring system, but they put it into the muffler. But then again, that's another story of another day, I think.
Yeah, yeah, that's true. It's funny, but you go to the Suva bus station, and there
Yes.
is a big sign that says, "Do not let your engines idle."
Hmm. Do not
But you
leave it
know what?
idle.
There are 20 buses idling, and there are the officials from the
Mm.
city council who are supposed to be monitoring.
Yes.
They have no idea because I don't think they really understand the
Hmm.
importance of having the diesels off.
Hmm.
So there you go.
Yes.
A lot of misinformation or no information
Hmm.
and lack of training
Yes.
by the authorities, I
Yes.
think, contributes a bit more to it.
Very true. Now, Uncle Jay, Dr. Jay, could you tell me what should a person do if they have limited resources regarding COVID? As you can understand, in Fiji, the radio, the airwaves, the radio Fiji 2 reaches into the urban areas and as well as the other places. But what do you think a person should do in
Well,
that sense?
I must admit, it's a real challenge. I visited Fiji. In fact, I had invested some money to develop land next to the airport,
Mm.
Lenga Lenga, 50 acres. And
In Lenga Lenga Hoige.
Ekdam, ekdam.
Okay. Yes.
uh,
Lenga levu.
It was very interesting, you know. I actually, luckily, I was able to save my money, and my brother,
That's good.
Master Narayan, was helpful in that regard.
Mm.
I actually sent a message to Shamina Sao Khan Narayan. She married my nephew, and they still
Okay.
live in Suva.
Hmm.
And she said she didn't have the technology to open up. I don't know, maybe she's listening.
Hmm.
But it's interesting to compare what
Hmm.
is available in the city versus, let's say, Lotoka and Ashok are very much aware of. Is is Lotoka now a city or
Yes,
like
it is a
Suva?
Yeah,
city.
it's
It
a
is.
city.
Yes.
It's a city.
Yeah, it's interesting, but you know, if you've ever been to the village life, it is really a challenge. You know, you rely
Yes.
on
Yes.
your neighbor to help you out. I
Yes.
just feel, I mean, I like to figure out how to create a system where we can help these people out. You know,
Mm-hmm. Especially in the.
and I don't know, I don't have a good answer, Param.
Mm-hmm.
In the village life, you know, I have nieces and nephews in Australia,
Mm-hmm.
and as well as in New Zealand. Actually, I have my niece is a lawyer, and her husband is a lawyer too,
Yes.
Lakshman.
Yes.
So they both
Now,
are lawyers.
now let's talk a little
And
bit about the. We've talked about the how people get infected and things like that. Now, can you talk a little bit about the immune system? How does the immune system works? If you can just
you know,
briefly explain.
immunology is a very interesting subject, and unless you go through biology, studying the science, you
Hmm.
know, antigen antibody
Yes.
is understood, and I think
Yaniki, hero or villain? Let's take it that way. A hero and a villain. That's probably an appropriate way to put it through. Antigen and antibody.
you know, one develops some immunity
Mm-hmm.
against the virus, but not enough, not enough.
Mm-hmm.
So you
Mm-hmm.
have to. That's why vaccine is very significant because concentrated they when you inject the when you get the vaccine you produce the
Mm-hmm.
antibody, and
Mm-hmm.
that antibody helps fight off the virus.
Right.
So
Now,
it's
the
very important.
consensus. There are
But
some.
the challenge is that you know many people in Fiji are immunocompromised,
Yes.
Yes. Yes.
immunosuppressed. My
That's a big
assumption
problem.
is that.
Now,
My assumption is that
could you explain a little bit the terminology, what immunosuppression is, so they can understand it?
well, it is caused by a specific kind of condition.
Hmm.
And I would maybe Ashok can help me here with diabetes, you know, type 2, type 1, type 2 diabetes.
Which is very
Uh,
prevalent in Fiji.
Very prevalent
Very,
in
very.
Fiji.
Yes.
And so they are already immunocompromised, you know,
Mm.
because and one of the most severe form of immunocompromise is lupus. People
Okay.
don't realize it. Hair
Yes.
loss would be a good example, not like me and you, but you know, people losing hair don't have enough immune system. So the condition that people have, you know,
Hmm.
I remember I have a handheld device because I measure my blood sugar because I'm
Yes.
type 2 diabetes, I have blood
Ye-
pressure, and I have this,
Yes.
that. And I do certain things that most people won't even do it.
Hmm.
For example, you know, we say doctors will tell you take baby aspirin. Well, I don't believe in baby aspirin. I take 325 milligram of aspirin every day, and I've been doing
Hmm.
it for 25 years.
Hmm.
And you're looking at me, and you know, I feel pretty healthy. So
Hmm.
I, if I use, if we both of us use our example, we're both type 2
Yes. Yes.
diabetic.
Yes.
Who's probably better controlled than me?
So,
And,
so
but
taking
but
into the
given
so talking
so,
about
so, so, so
immunosuppressed.
you're already immunocompromised, which
Yes.
simply means you don't have enough antibody to
Okay.
fight off certain
Because
kind
your
of.
body is busy fighting other things as well.
Uh,
Exactly,
very low immunity in our population in Fiji because of the
Yes.
prevalence of
Uh huh.
NCDs.
Yes.
And you
And
know
if
the
you could if
NC,
you could clarify that little acronym
it's
that you've used.
okay. It's non-communicable diseases. It is a combination of things like diabetes, blood pressure, high cholesterol, all these things together create the non-communicable diseases. And it's a silent killer. And in fact, that has been a problem all over the world. And in Fiji as well, it's not no exception. It is killing more than 80% of our people. The cause of death would be one of the components of the non-communicable diseases. Okay, it's going to be either a kidney failure or a heart attack or a stroke or things like that. So when we talk about NCDs, nobody knows what it means. But when we say, okay, heart trouble, kidney trouble, all this other trouble, diabetes, yes, 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 then everybody knows what it is.
Could you tell me what percentage of the population in Fiji would be diabetic, or for that matter, what percentage would be NCD related?
Well, I'll tell you what,
Fact,
80%.
80%. That's a
80%.
high number, Doctor
80.
J.
And
Yeah,
this is a number that I did not make up. This
Yes.
is a number made by the WHO. It's a
Mm.
number made up by the medical authorities in Fiji itself.
Okay.
And a few years ago, it was declared as a endemic, as a problem
In
for
Fiji.
Fiji.
Wow.
Unfortunately, nobody in Fiji, including the ministry,
Mm.
uh, the action that we took to combat that was business as usual.
Okay.
When
Okay.
you have an epidemic,
Yes.
your action has to match that epidemic. Unfortunately, in Fiji, it was not done because I think of the lack of resources.
Mm.
So instead of accepting the fact that we did not have the resources to fight it, we just declared it, oh, it's a lifestyle disease and
Okay.
let it
Okay.
be.
Okay.
And
Okay.
that is the saddest part
Mm.
because a lifestyle can be changed. People can be made aware of. Education would have gone a long way towards solving this problem if we, which means the government, the private sector, the public sector, and the people got together and addressed this thing at once and in unity. Unfortunately, that didn't happen.
So going back to, as you said, there's 80%. It was by WHO to some extent. It was said it is an endemic. Now, do you think that will be the same, that they are taking it lightly for this pandemic, which is a coronavirus? That okay, it's a something there to for us to live with. Is that the case? You reckon that's happening? That's why the low percentage of people are getting vaccinated in Fiji.
It's a very sorry state of affairs. And it's not only in Fiji, out here in the US as well. We have these two groups now. There was a time when vaccinations were the rule, and the decisions were made by doctors and scientists. Today, we have politicians and religious zealots who are making decisions
Okay.
on medical issues. So you have this confusion, and people who cannot distinguish between, okay, shall I follow science or shall I follow the politicians? And
Okay.
this is where the big problem is. Not only in Fiji, in the US as well, a country that is supposed to be literate. We have only
Yes.
49% people that are vaccinated.
Fully
Isn't it
vaccinated.
sad? Yeah,
fully vaccinated.
Oh
yeah,
goodness,
fully
it's only
vaccinated. Oh, it's only
49%.
49%, not even
Wow.
50%.
Yeah, but,
In here, in US,
one of the
imagine Fiji.
by my personal experience, I was at a wedding in Nawaka village, and the groom's father was not feeling well. I checked his blood pressure. I happened to have the machine to check it, and his blood pressure was off the roof. And I said, "You have to, we should go to the hospital." Oh, no, 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 I can't go. I can't leave.
Mm.
So he rested, and after the wedding was over, I told him that you have to follow up. One of the challenges in Fiji, if not in this country, but certainly not as much, is
Mm.
that people get start to feel better, they stop taking medicine.
Okay,
Yeah,
You
okay.
know, so unlike
exactly.
the diabetic medicine, the blood pressure, you have to once you have it, you have to take it all the time. So
Mm-hmm.
that's
And
unfortunately
can
the
I add
issue.
something to that? You
Sure,
know,
sure.
I consulted with a lot of doctors and all, and the patients that we screened
Mm.
had blood pressures and diabetes. The numbers were out of, going through the roof.
Mm.
But you know what they told me? I asked them, were you ever on medication? Oh,
Mm.
yes, yes, yes. The doctor gave me the medication and everything was okay and I stopped it.
Mm.
That's exactly what I mean.
Mm.
You know,
Yeah, yeah.
and
So
the
I think,
saddest thing,
yeah, I
the
think,
doctors were not telling them that you have a condition that is not going to disappear and it
mm,
has to
mm,
be controlled, and it
yes,
has to be controlled by medication, and which means constantly taking the medications as prescribed.
let's prescribe, follow the rules basically,
No,
Yeah,
which
just on the
boiled down
Fiji,
to that.
just on the
yeah.
Fiji side, up to 80% Fijians are vaccinated. Can that be true?
No, no, that's not true at the moment. Not at all.
80%. I just can't believe it. That's
No, no,
what.
no, no,
And the
that's not
second
true.
thing, Edwin Nunn says that 1,163 new cases of COVID within 24 hours. If that's what's happening,
Mm-hmm.
they're going to have a real challenge trying to
Mm,
control COVID 19. I mean,
mm-hmm.
it just doesn't make any sense. 116,
Uh,
that's a lot of people within 24 hours being infected.
you know,
Yeah, just quickly, let me just show you something on the screen to both of you and in the audience that are actually watching this program.
oh, wow,
And
wow,
if you can see
wow.
from there, there's coronaviruses in Fiji. The deaths 233. Coronavirus cases is 28,000, and
Mhm.
recovered is that much there. If you can see on the screen, and if you can see, that's the curve that's actually going up tremendously, and the total
Wow.
cases from its inception, the diseases, and those who understand the graph system, and
Mhm.
can understand basically total corona deaths graph as well. It's rising slowly. Daily deaths in Fiji, and if you look at it, if you look at this curve here, and if you
No,
look at it,
no,
you look at this in July 21, they were 21, so it's peaked over there,
Yeah.
and
The ratio, the
this
ratio
is the
shows we are the
yes.
highest in the world.
So July 30th was yesterday, and according to that, you can see this is the data taken out from July
Mhm.
30th. But if you look at the number of deaths, that's currently trailing in Fiji. That's currently what's happening, and globally, this is globally that's happening in Fiji at the moment. If you can see, sorry, not Fiji, but globally, if you can see, that's the curve around globally, and you can see here on all the dots, that's where everything is happening. 197 million people, and there's cases around. So the world's population is currently about 7 point something billion. So, and 4.2 million deaths now. And all those countries, if you can see, are all affected. And there's a big, big, big problem at the moment. So, coming back to our conversation here, and all three of us on the screen here, it's a big story. It's a big drama, and which has started, and it started in 2019, and now it is in the middle of like a story has a middle. Everybody's got to enjoy the story, and that's going to be an end to a story. So as any filmmakers make, so there's a emotions going up, the emotions going down in a film. People cry, people laugh. So this we are going through the emotions at the moment of COVID-19. Now let's hit and talk a little bit about vaccination. What can be done? There's few things that we need to do. What's so important? We'll go with Ashok first.
First, it's most important for people to understand what vaccinations have done in the past. The vaccinations came about because of scientists and doctors, and they were able to arrest of beat 14 different medical conditions. And if you want me, I can read out the 14 different things that were beaten by vaccines. And then were chickenpox, diphtheria, flu, hepatitis A and B, HPV, measles, meningococcus, polio, rubella, tetanus, whooping cough, rotavirus, all these things were beaten back by vaccines. So
Yes.
why are people fighting vaccines today? I cannot understand that because today we are being misled, misinformed by politicians and people who have no idea about health.
There's a
And these are
conspiracy.
the
There's a
people.
conspiracy group at the moment. There's a certain
Yes,
percentage of conspiracy going around the globe. It's
absolutely,
a
absolutely,
globally.
and there's the greatest disservice to humanity all over the world today
Yes.
because of social media. They're
Yes.
coming up with all kinds of posts that are trying to debunk the goodness of vaccines. And I
Vaccination.
keep telling people, please forget about all this. Open your mind to the science behind it. Science has proven that 14 different problems were solved by vaccines. This can also be solved if we all decide forget about the politicians, forget about the naysayers, forget about those conspiracy theories. Just follow science and follow the doctor's orders.
And don't
You
follow the
will
world
be
control population. All these conspiracies are there. You know, the coronavirus
just
is to control the
yeah.
world population, to this and to
Absolutely.
that.
Oh no, no,
It's a
that's
lot
all
of
BS.
drama. Yes.
Whole lot of BS,
Yes.
unfortunately.
And
Well,
Dr. Jai?
vaccine is very, very critical. Especially now because of the Delta virus, Delta strain. People that are filling up ICU beds in the hospital are unvaccinated, and they are catching Delta virus. And I took my car, my wife's car, for service. The guy that owns the garage happens to be a friend, and he said he doesn't believe in vaccine. I said you don't have to believe it, just take it.
So what did you do to convince him?
He wasn't convinced. He just
Yes.
wouldn't. And while we're discussing, another customer comes in. He said, "Oh, I just took the vaccine." I said, "See, this lady knows what she's talking about. You gotta do that, because
Yes.
if you lose his garage, your father is not gonna be able to manage because
Yeah,
it's a Mercedes European car garage." And so, but anyway, earlier we mentioned about being fully vaccinated. Moderna as well as Pfizer, you need two shots, where J&J gets only one shot.
Okay.
And there is some concern that maybe you need to take a booster shot.
Every year.
Why? Because then your body is full of the antibody that we talked earlier about, and those
yeah,
antibodies are going to protect you.
So the
yeah.
So,
bodies need to be fitted with heroes in there, apart from,
Right.
all the bad
Soldiers,
men,
soldiers,
soldiers,
soldiers
soldiers
to
and
fight
heroes.
off
And
the infection. Yeah.
yes, as soon as the villains get into your nose, they make their way and they crawl their way. Or for
Yes.
that matter, you can say in Indians, who's that? Who's that person? Lanka. Like I said, what's his name?
Oh, Hanumanji.
Hanum. No, 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 no. The guy, the other person. Lanka Kiskera. What's his name?
Oh, Ravan, Ravan.
Ravan. The Ravans get into the nasal passages and they walk their way. They go through the lungs, and the
I think it's
lungs
a
may
good analogy.
the
So we
lungs
need
may.
we need a Hanumanji to go and burn that place down.
Well, apparently, when you talk about burning, there were lots of bodies burnt in India. Lots of bodies, deposited and eradicated and demolished and whatever you could say, whatever word you can terminology you could use it. Even in Italy, they had such a high case. And now, what do you guys think? In Fiji at the moment, the fully vaccinated is about currently about closing to 13 to 14% in Fiji at the moment. Now, what do you
Very
guys
low.
have to say? What do you guys have to say? Now we are just picking up the pandemic, and it is going to go worse. So,
It is.
what is your thought on that?
It's a warning. It's a warning, and if we are not going to become aware that this danger is right over our heads. Fiji is going to be decimated, decimated. If economically and culturally, politically, and every other way you can think about. It is so serious, and I want to appeal to every Fijian who's listening to this. Please check out the witchcraft. Check out all these naysayers. Check out the social media. Just follow doctor's advice. That's the only way we're gonna make it, because science is backing the doctors. And if we don't follow science, we are in for a very, very rough ride. Not only
Yes.
for now, in the terms of loss of life and all the things,
Yes.
but the impact it is going to have on the entire country.
It's
We're
loss
going
of
to suffer.
life. Loss of life is it's happening, but the thing is, you won't be able to see your loss. Even the person is
Is,
passed away, they're sealed up. They're sealed up. You can't
is
even
the
see the
vaccine
face.
is the vaccine in Fiji given at no cost? Do you know?
Yes, it's free. It's free.
Yeah, so he said, why should you get COVID-19 vaccine when it's available to you? Why? And maybe what needs to happen is to be able to say the benefits, the benefit of getting the COVID vaccine. And here it says here, the COVID-19 vaccine authorized for emergencies may prevent you from getting the infection. Not may, it will, and becoming seriously ill with COVID-19 or dying of COVID-19. I mean, it's very simple. Number two, the vaccine can spare you from long-term side effects, such as heart problems or breathing and all that, which can persist even a mild version of disease. The vaccine can help you get back to activities that you love. Like in my case, I love to play golf. I haven't played it in 18 months. I
Anxiety is
was
a
a
high.
club
Anxiety
champion
is high.
twice.
Mental health is increasing due to people staying in
Very,
home. Children are
very
Big,
turning into other problems.
big time, big time,
Yes.
big time. Because we are living in a state of confusion, and
Yes.
I think one of the reasons is that the prevalence of our social media that is feeding the misinformation, and a very sorry state of affairs
I
that we
should
are
not.
listening.
I think I should not say social media, but I would like to say some people that are active on social media and are using social media platforms as a means of targeting to people like this. There's a certain amount of group, a certain amount of people that are using this platform to target people, saying, "Look, this is vaccine is bad. Vaccine is going to demolish you. They are going to, if you're dying from, some are saying." I've heard this in Fiji. Don't quote me. I've heard this from Fiji. Some people say, "Arey, it's only a flu, and that's it. You get better." But the post-COVID, it's just like when a cyclone comes in Fiji. There's always a post effect to it. Yeah, doc. There's a post effect to any cyclone. So think
Yeah.
of a principle as a cyclone, which leaves a trail of disaster. So
Yes,
obviously, COVID would leave some sort of a trail, wouldn't it? They wouldn't
it
go
is
like
going
that,
to.
huh?
Absolutely, absolutely.
Lanka got eradicated, so that's how there was a bit of a trail. Doc, what do you think when people recover from COVID, what would be the trailing diseases? Any thoughts on that?
You mean after recovering from
Yes,
COVID-19?
yes,
Well,
yes.
it depends on the individual, depends on what kind of condition you are in or you were in before
Smokers,
getting the COVID.
smokers,
But
diabetic, high blood pressure.
Yes, yes,
yeah,
yes, yes.
all of those would still remain, but it may get worse.
Mm-hmm.
Uh, in my opinion, I think it probably gets worse because you were already compromised
Mm-hmm.
and the virus that you got didn't help. And it depends on the virus, especially this nasty Delta virus
Yes.
system is very, very bad. I mean,
Mm-hmm.
Dr. Fauci said something, and I wrote it down, and I don't know
Mm-hmm.
where it is right now.
Mm-hmm.
Uh, yeah, then Dr. Anthony Fauci says that masks are back.
Mask are
Masks
back in America. Yes, yes.
in America.
Mm-hmm.
And unfortunately, the Republican guys, especially Governor Greg Abbott from Texas,
Mm-hmm.
and Ron DeSantis from Florida refused to take COVID-19 seriously. I mean,
Mm.
we're talking about Fiji, but look at these guys. They're governors of the states.
Yes.
And they
And
don't believe in it. So, can you imagine trying to convince people that are barely making a living to say
Mm.
you need the vaccine and so forth? I think it has to be door to door kind of
yeah,
coercing and making them help. I am willing to do my part. I'm willing to go there and help out. Like I said, I invested some money. I was trying to help the native Fijians, but also our Indian brothers. I mean, if you look at it, how many brain power has left Fiji Islands?
Yes, very
You
true.
know, it
Now,
makes
you
a
know.
now tell
Sorry.
me, what would you guys think? How could we counteract these conspiracy theorists that are actually spreading the words that virus was made by people, that virus was deliberately released amongst the society, that virus was released to control the population, that virus was released to counteract 5G? There's so many conspiracies, and these people are so uneducated.
And it blows your mind and blows my mind
But
to
there are some
think
people. There
how.
are people following it.
Yeah,
People
and
are
you know
following
what?
it.
I have friends who follow that, and I
Yes.
can't for the life of me understand
Mm.
why. Because
Mm.
these are educated young people that I have more confidence in.
Mm-hmm.
Unfortunately, I cannot explain why they
Mm.
are blind, deaf, and dumb.
Mm-hmm. So, how would you advocate, Doc? How would you ever advocate if you were, like, for example, in Fiji?
I happen to watch that the funeral services sometimes shown on
Yes,
the
yes,
television.
on the line, yeah,
Yeah, and it really hurts. And I
yes,
see the condition with this small hurricane or typhoon or what have you. It
mm,
really hurts.
mm,
These people don't have $2 in their pocket. How can
mm,
they make a living? How can they focus on something else? I think the standard of living has to be brought up.
mm,
And how do you do that? I was in the sugarcane field for at least 4 years, and
mm,
I'm telling you, we have no way of knowing where the money goes.
mm,
My mother owned the land, so she used to go and get the money that was paid by the government. We don't know. There's no way of keeping a statistic number. Thank God for my eldest brother who
mm,
worked in a grocery shop, and he's the only one that knew whether money came in or money went out.
mm,
When I finished writing the book, it hurts that
mm,
how many other people would be in the village life that own land which they can't own anymore because the natives want to take the land away, but they're not doing anything about cultivating the land. They want the house, the home
mm,
that they stayed in. I would go to Nawaka village where my property was, a tin house that I was raised in, and a bure
mm,
house,
mm,
and it's all taken over with the Fijians. And the
mm,
land, 10 acres of land is not cultivated. So
mm,
you can multiply that times how many people? The
mm.
farmers are in bad shape.
Yes, yes. There is some
There's
trailing problems in Fiji in that sense, and that will always
there's
stay,
yeah.
I think.
There's more to it than that.
Mm-hmm.
And a lot, like I said earlier on, lot of misinformation is around there.
Mm-hmm.
If we really analyze,
Mm-hmm.
nobody is stopping. Now, I could go and apply for a agricultural lease
Mm-hmm.
that will give me 33 years today.
Mm-hmm.
Okay, and I have, I think, two. I'm not quite sure, but two extensions are guaranteed.
Mm-hmm.
So I have the opportunity if I want to. But what has happened is that the misinformation that has been going around, and we have gotten accustomed to this idea, oh, the land was taken away.
Mm-hmm.
Yes, a lot of land was put into reserves. That's true.
Now
But
let's
if
not
you want to
divert.
go back, you
Let's
can.
not.
But that's
Yes,
not the issue. I know.
yes. Let's not divert into that land issue,
Yeah.
which is probably another
Yeah.
topic for another day. We
Yeah.
can discuss on that.
Yeah.
Today we are heavy hitting on coronavirus and coronavirus. There is when there's people lining up to get vaccinated. When they're lining up to get vaccinated, there's a few things and principles they should follow when they're queuing up to go and get infections, injections. Even getting a drive-through injection is very important. When you're queuing, you must stay. You must follow the COVID rule, even the protocol. Have your mask
Yes.
on. Do not start flipping your phone. You keep on flipping your phone, even if you get your mask on. It's not good. Just stand in the line. I know people could be standing in there for hours. Could be hours, but uh, do your best. Get vaccinated. And also, I would like to say that we salute our frontliners. Yeah, Doc, you
Oh
would
yeah.
be able to, being an immunologist background, you would be able to, reiterate as to what happens when someone is in front line. As a frontline worker, what would you like to say to them, Doc?
You mean
People, the
the
doctors and the
healthcare,
nurses and the immediate health.
the
Yeah.
healthcare people are, I know a young lady that just became a nurse
Mm-hmm.
from Nandi, and they had a very rough time going through the nursing school.
Mm.
And I sent her this, and hopefully maybe she's listening
Mm-hmm.
in Fiji. It's very challenging for everybody from my observation. Like Ashok said earlier, when I was there, we had a meeting, and
Mm-hmm.
um, very frustrating. It's like it goes from here, it comes out here, and people are not able to capture what you are trying to suggest. How
Mm-hmm.
I don't have a solution. Pandit Salen goes every year to help students in the grammar school, but he goes to Lambasa and not in
Mm-hmm.
Viti level. It's okay. I don't know much about Lambasa, but it would be a challenge for the healthcare workers to manage
Mm-hmm.
the COVID situation.
Yes,
They would
yes.
need a lot of support and help.
Because they would be
Uh,
working lots of hours as well, putting a lot of hours. They are probably not be able to go to home. They can't go home because they have to isolate themselves. And because if they have to go home, they are basically carrying the disease over. So they will have to be isolated too. And psychological effect that comes on with the doctors, the availability or non-availability of respirators that would be required for people that would like to breathe, plus the medications, the temperature checks, the mask, the PPE, the personal protective equipments, which is required on a daily basis because they are just chucked out. They have to throw it. So these are some sort of things.
but Ashok has a better handle on the community because of what you were doing. I mean,
Hmm.
I kind of see you posting it on Facebook, and so you have a pretty good idea about what the thinking is. And there's no question, as human beings, we are economically driven. We want to be financially well off
Hmm.
and be happy with that. Uh, uh, we don't tend to feel like helping the neighbor when you see they need help.
Hmm.
But the system, it seems to me, Fiji is a small place. It's less than what 940,000 people.
Hmm. Hmm.
When I left was 700 something. 51% were Indians,
Hmm.
and I think the Indians are now only 25 to 30%, or maybe
Yes, about 39%, roughly, something like that.
39. It's
Yeah,
gone
something
up
like that.
there.
Yes, yes. No, the
Well,
Indians
I'm
have.
not going.
You've left.
But if somebody is listening on this dialogue here, I
Hmm.
would love to make contact. In fact, Pandit, I give him some money every year to help buy books and pencils and what have you
Hmm.
for the students. And my brother was, anyway, would love to create some kind of system where we can begin to help. And how do you know whether that is workable or not? And
Hmm.
again, Ashok probably knows better.
How can you educate, Ashok?
First, I'd like to go back to your original question. First, I'd like to record my personal acknowledgement for the work that the frontliners are doing. They are risking their own personal lives to
Yes.
save others, and for which I, and on behalf of everybody, salute them. And we must appreciate what they're doing. We must also understand they're human beings.
Yes.
There's only so much they can do. They can only work 26 hours. They need to take a break. There's a whole bunch of things that go with it. And I cannot stop thanking the frontliners. And especially in Fiji, where we are resource challenged. We are challenged in our resources in Fiji. And the doctors and the nurses and all the medical personnel are trying to do the best they can with what they have, and
Exactly.
for which they should be applauded, and we
Yes.
should say thank you to them. And I'll tell you what, there is a doctor that we know of that got infected, went home, his parents got infected, and all three of them unfortunately died.
Wow. This is in
So
Fiji.
this is in Fiji.
Wow.
Now you can see the price that our medical people are paying in Fiji. Doctors, nurses, and all allied workers who are there helping to take care of the COVID patients.
Because
It's
Fiji,
not a game.
yes, Fiji is usually, if you see the natural disasters that happen in Fiji, basically cyclone and,
Mm.
you know, most of them is cyclone, and due to cyclone and heavy rain, there is flooding. So
Yeah,
apart from that, you don't see major diseases, major problems in Fiji as far as natural disasters are concerned. So no other country in the world was prepared for this.
and the
They were not prepared for it. So people should also consider that much, that this is something which is new. It's like a brand new Mercedes. How are we going to drive
Yeah,
it? How are we going to
yes,
press
yes,
the
yes.
buttons? You know how you sometimes you go
It's
and
still
buy a new
learning. It's
car,
still
huh?
learning.
Yeah, you
It's
just
still
go in.
learning.
You go and see ki, how am I going to drive this Mercedes? Okay, it's a left-hand drive. Well, how do I drive a left-hand side? You got to study it. And some people want answers. They want to sit in the car and they go. And some people will say, no, I'm too scared to drive the Mercedes because they can't afford it.
It is very interesting. I have a number of young people that I know who are in the lab sciences,
Yes.
and I had a lot of dealings with them. I had a lot of dealings with prospective doctors who were students of the medical school, and I had used them as my surrogates and my helpers, and they're the ones who were talking to the patients and people generally, and educating them and taking their blood pressures and taking their cholesterol readings, and then
What
Apologies.
happened?
Apologies. Press the, apologies
oh,
for
that's
that.
okay.
Just happened
That's
to be in the
okay.
middle. Yes, keep going.
So all these wonderful people in Fiji
Yes.
that have been working hard, trying to do the best they can with what they have. And
Yes.
I want to record my appreciation for that. And now, the bigger problem in Fiji, as I see it, is this confluence of two schools of thought, one conspiracy based and the other science based. And the conspiracy based is saying vaccination is bad, you have to have this, that, it is causing this, that. And even some very learned doctors, in my opinion, are misinformed, and they follow medical ethics, for example, as being more important. When you have a pandemic, all the civil and the normal actions we take are put aside because we are in an emergency and we
Yes.
have to act. in the emergency. And I
Yes.
must applaud the government for trying to do what it can do.
Hmm.
And Fiji was not prepared, just like the whole world was
Hmm.
not prepared for a pandemic.
Yes.
They have it, they're trying to do the best they can, and we must support whatever is being done to help the people. And the
Now,
people must get
behind
on
it.
board.
Yes,
They
But
yes.
have to get on board. And like
Ashok,
they say, God
what
helps
is that?
those who help themselves.
What does a support look like? I mean, how can we support them? I mean,
Well, first is awareness. If we talk to everybody we know and we
Hmm.
explain to them, listen, please do not listen to the naysayers or the conspiracy theorists.
Hmm.
Please go with science, go with doctors, go with
Hmm.
the medical profession. They
Hmm.
are the ones who are the authority on this issue and they can guide us better.
Hmm.
And if we all get together and did it, we
Hmm.
can beat it.
Now,
But if we
recently,
don't,
on that subject, recently, the lot of audience are, punching really heavy because the government made a statement. Over the statement was came out of the government that no jab, no job. Basically, meaning if you don't take a jab, there's no job.
yeah,
So
yeah.
a lot of people are objecting to that by saying that that's not the way to put things. That no jab,
Mhm.
no job. And I suppose that that rule was taken, or the way it was actually processed by the media or whatever, whoever actually put it out, that's the way people accepted it. Now people are not accepting it because people are retaliating to that,
Yes.
and I suppose it's kind of difficult in this situation to explain that, hang on, we're dealing with a pandemic, how do we get
Yeah.
under control? The biggest question is, how do we get control of COVID, especially in a country like
Vaccination,
Fiji, especially in a country like Fiji.
vaccination. The only way we can beat it is by vaccination.
Vaccination.
Until we reach like 80% of vaccination people, we will not have a herd immunity. And therefore, this virus is going to stay alive and keep mutating. And let me say this, if we are not going to be careful, this virus can mutate again, and the Delta variant could become a smaller variant, and we could have a new one on our hand that we can't fight.
So
So the
at the
best thing
moment
is to stop it now. Stop it now. Don't let it go any further.
the
my
Delta
my
force is active. Yes,
Yes.
keep going.
my thinking would be, going beyond the hospitals that currently exist. I think you need to start small clinics
Hmm.
specific to taking care of the Delta virus,
Hmm.
and specialize in that area, and make it available throughout Fiji, in the small areas. How many hospitals are there in Fiji, and where are they located?
Yeah,
I
on the
mean,
major
from our
centers.
village from our village in Nawaka to the hospital in Nandi, and Nandi Hospital was really not, you know,
Hmm.
the class that I would like to see. I
Hmm.
mean, for me, being in the diagnostic field,
Hmm.
you got to have the technology to help do the right kind of thing,
Hmm.
and then to be able to teach and train, and make sure that people are able to learn
Hmm.
that in chronic disease or chronic conditions, it's not over. You have to be taking it over and over and over. And
Hmm.
you have to be checking every 6 months. I mean,
Yes.
and the mindset has to change. But if you are having difficulty and challenges to making a living, which is a big part of, I think, the village life, I think, in Fiji. I mean,
Hmm.
I see some of the homes and the sleeping conditions and the food intake, the water supply.
Hmm.
It's awful.
Hmm.
But when it comes to COVID-19, it's very serious pandemic. And in Fiji, you could see, in the village life,
Hmm.
farming communities, native Fijian villages
Hmm.
run by Tokis, or If you could start to have small clinic in these areas where
But on,
people don't have to.
on that, I think I would say the village life is more safer because they are doing social distancing. People are not getting there because they're what the villagers have done. A lot of people who are living in the urban area, some of them actually gone back to the rural areas by saying, no, we are safe. We're not going to take injection. We're going back to the village, and they have actually isolated themselves. The Ratus and the chiefs have isolated the communities by saying, we're going to stay here. So the chiefs and the villages are working well. It's the urban people. If you look at the corridor from Nasinu to Suva, is heavily populated with coronavirus at the moment. So there's it's all the urban areas which is a problem, and that's where the movement is. Now that's where the movement is. People going, for example, I don't know, don't quote me for it. Say, for example, having a wedding ceremony, a puja, or a grok session. In Fiji, we're used to seeing friends every day. Everybody, talanoa session.
Yeah.
How's your day? Every afternoon, people sit around a bowl of grog and discuss how your day was. That's the style of living Fiji has been used to it. But apparently, you can make a law, provided the law is followed. Any government, any institution will make a law, provided you follow the law. I think this pandemic, the law is the same everywhere, but people are not following it. And it's a people's disease. It's the people's disease.
It's true, but you know what? In Fiji, there are health centers and all over the place. Okay. Now, if the right, like Moderna or J&J, Johnson and Johnson, that doesn't need refrigeration, that
Yes.
is kept on room temperature,
Yep.
it can be easily logistically sent to all the places where it's not going to go bad, unlike the AstraZeneca.
AstraZeneca,
Now,
yes.
yeah, and so if they are using those things, then they can vaccinate more people. That's number one. Number two, if the religious leaders who are very influential in Fiji, in our communities like that, so if they step up and say, please, forget about the naysayers, follow the medical advice. If they come up strong on that, I think we could get someplace.
Okay.
Otherwise, it is not going to work. And I understand the manner in which the no jab and no job came up. It was a strong message.
Message,
I
yeah.
think we got caught up with this word, the strong ones, and we missed the message behind it. The
Yes.
message behind, as I understand,
Yeah.
is that it was imperative. It was so important that if you don't get
Get
yourself
the vaccines.
vaccinated, don't come to work because you
Yes.
are a possible carrier and you
Yes.
could be infecting others.
Yes, yes,
And
yes. Very true.
I personally, I don't see anything wrong as being a health advocate. I would like to advocate that the naysayers are absolutely wrong in this case. Please follow the science, follow the doctors, and we will be able to beat this. If we do not, we will have hell to pay.
Now let's come towards the end of the program, and I'd like you to, as well as Dr. Jay Narayan and Ashok, to have your final say on this COVID matter. Before I do that, I've got some slides here by saying a few quickly slides. Removing mask and all that. How to remove the mask? It's on the screen, and people can obviously follow those procedures as to when they're removing the mask, how to remove the mask. If you are reusing the mask, how to keep the what's the hygiene process of it. And basically, these are the few things that people should go through, and these are the testing methods which they can actually pause the screen in a later time and come and have a look at it. And they have in the centers, I believe, they have so many places where they could go and get more information, and such as where you should know your emergency number. 24/7 COVID hotline number in any of your country, and you should ring and Stay up to date with all the information that's coming as far as COVID is concerned. Because if you don't stay up to date, you don't know what's happening. The next door neighbor, the next door neighbor is actually isolated themselves with so many tarpaulins closed, so you don't know what's going on. So it's very important to get information and stay up to date with COVID. Okay, guys, it's been a pleasure talking about COVID. Have we missed anything? There's always a big topic to talk on, and it's never ending, and we cannot finish it in such a time. It's already an hour and a half now, and I think, yes, it has. It's an interesting topic, but I think the motive is individually, there's a message for everybody to take away from this feed that what COVID is, it's here to stay. It's not going anywhere. Any in closing, your closing sentences or
Yeah,
closing in closing?
actually, I have here. It says, you know, much is still unknown about COVID-19.
Yes.
Will affect people over time, but research is going on.
Hmm.
Research recommend that doctors closely monitor people who have had COVID-19 to see how their organs are functioning after
Yes.
recovery.
A very
So
good
it's very,
point. A very good point.
yeah,
Post COVID.
very important to follow up. Just because you recovered doesn't necessarily mean
Very true.
your heart, your lung, your kidney, liver, and so forth are functioning properly as
Yes.
they should.
Yep.
I personally believe in a general medical checkup at least once a year.
Yep.
You know,
Yep.
I saw an ophthalmologist today about my eyes. She was absolutely excited. A
Hmm.
wonderful, condition. I see a general practitioner. I see a orthopedic,
Hmm.
urology because of being a man with
Hmm.
prostate issues.
Yes.
So, uh, care for people who have persistent symptoms or related illness after they recover from COVID-19. Support groups are available as well.
Yes.
That support group is very important.
I'm
And I
not
think
quite sure about Fiji having a support group, but I know in America and India and other countries they have set up a support group regarding post-COVID traumatic patients. So I don't know about Fiji. I'll do a bit of a research on that. I don't think so, but I don't know. I could be wrong. They have at the moment they are just trying to deal with it at the moment.
I know,
First,
but the thing is, the important thing is too, just because you recover doesn't necessarily mean you are
Yep.
okay now,
Yes, yes. You
You
could you
need
could
to
you
make
could die
sure
of a
that,
heart attack in 6 months. You could have some sort of a
exactly.
yeah. You could have a breathing capacity deteriorating at a certain frequency. We don't know.
So that's an important message to
first,
leave behind.
Hmm.
first, first things first.
Hmm.
We have a pandemic.
Hmm.
We have this COVID going around creating havoc. Let's address that first.
Hmm.
Let's stop that first by vaccination, vaccination, vaccination.
Hmm.
If we have done this thing, we've stopped it, the rest we can take care of later.
Then let
You
me
know,
just get an argument point in there before we finish. Let me just get one very important argument. The important argument at the moment that I'm listening from around the people is let's lock the country down completely. I would like to get views from you too.
wow. If you lock the country down, we were
In,
locked down before
in at the moment, in COVID scenario at the moment.
in
What do you
commitments.
think?
Nothing came.
Hmm.
When we were locked down, when COVID came about, Fiji locked itself out. Borders
Hmm.
were closed. Nothing happened. They were
Hmm.
doing very well.
Hmm.
Okay. Now, one person comes back from India
Hmm.
and he infects the security guard. The
Yes,
security
yes,
guard is infecting the maid, and the
yes,
maid go back and infect their families.
yes.
That's just started a super spreader.
Hmm. Hmm.
One little thing, it's like a wildfire. So we are suffering from that. And now it's too late to go into preventive. Now we have to work diligently getting
So,
to
so
stop
you,
this.
so you saying
And
complete lockdown is not going to work? Is that what you're saying?
what is it going to do?
Hmm.
Yeah,
Vaccination, 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 complete 100% vaccination of the people in the country is the only way to stop this. There is no other way. Now,
Okay.
a country just closing the country down is not going to do it. It's not going to do it.
Because
People are,
it's a people's disease.
that's right. And we have to stop that COVID, not people. And now, if people realize that they have to wear masks, they have to clean their hand, and they have to keep social distance, they do not know the next person, is he a carrier or he's not a carrier. Now, we have records of people that have been inoculated, vaccinated, and they've got the 12 2 vaccine, yet they pick up the disease from somebody else. Now,
Yes.
they don't get sick. They don't get sick, but they're carriers. They can pass on to somebody else. And the only way we can solve this problem, as I see, and it's a personal opinion, is to concentrate on vaccinating more than 80% of the population of Fiji. That would be the only way to put a stop.
Okay. On the doctor's point, what do you think about completely locking the country down? Now, theoretically, it'll take about 3 weeks. As you say, the window period is about 14 days. Now, if you look at that perspective by saying if you lock the country down, which means, total restriction of certain things, you can stock up your pile, your food and everything. But what people are hitting on and saying, we should have a lockdown. We should have a lockdown. Now, Doc, what is your perspective on that?
I think when you're dealing with pandemic kind of situation,
Mm-hmm.
I think there has to be not only one approach. I think there should be more than one approach. And at this moment, I don't know which those things are. I think vaccination is very significant, very important.
Mm-hmm.
And I have a list here of at least 20 different kind of conditions that people have had:
Mm-hmm.
anthrax, HPV, pertussis, rubella, smallpox, tetanus, hepatitis A, hepatitis B, all of these kind of conditions
Mm-hmm.
that people already have. I think one of the challenges, among few others, in the U.S. is democracy makes it very challenging to
Mm-hmm.
work with people. And Fiji, maybe you could succeed. But again, I look at the small areas, small towns. What does the lockdown mean to them?
Mm-hmm.
Raising your own vegetable, your own chicken, and all that. I do that right now. I have my own vegetable garden, and I used to raise chicken, and I taught my children, my
Mm-hmm.
grandchildren at least. But
So,
but I mean, you gotta try different things to see what works, and
yeah.
I wouldn't rule it out. I would say, yeah, we're gonna try it, but I think Ashok's point is well taken.
Mm.
Well, vaccine is the best solution, but I have run across people that don't have anything to do with it.
Mm-hmm.
What do you do with those people? And they will infect somebody else. Is there a punishment for them?
Yes,
You
yes.
gotta do something to say, this is what's going to happen to you if you infect somebody, and how do you make that happen?
Well, that's what happened
So,
actually. Coming to that, that's what happened in Australia. What they've done is they've actually locked the country, but not fully locked down, but they had lockdown in certain areas currently in Sydney. So, what the government has done, they decided, they looked at people and saying, hang on, the infection rate's going up, nobody's actually listening, nobody's following the rules. So, what they've done is they have got the restrictions a little bit tighter. And the next line of defense, what they've done, they've increased the fines. So, whereas if you had no mask, you'd be paying $200. Now you'd be paying $500. So, what they've done is increase the fines in order to, and also advocating that you should get vaccinated. And if you're not wearing a mask in public, you can't see, you can't go, you can't travel out of your local government area 5 kilometers out of there. So
right,
basically, you
right.
can't go to gym. Gyms are closed. Only food and the essentials are open. You can go and see doctors. So only the essentials are open. So what they've done, they said, let's put a fine to it. You can't go and see a buddy which is 5 kilometers away. You can't have a grog session. You can't have a music session. You can't. You got to follow the rules. Stay in your 5 kilometer rule. So that's the approach they've taken at the moment. And policing that is very important. The way to police it is introduce fines. I think that's probably going to work, but I don't know. That's what's happening in Sydney at the moment.
Well, it's always there's an approach that has a benefit and also
Yes,
a penalty. So if you are going to do something that is going to jeopardize
yes,
the approach towards solving a problem, then you must be penalized.
yes. Of
And
course,
maybe
very
that's
true.
the only way to go.
Yeah. Well, nevertheless, gentlemen, it's been a pleasure talking to you two. We had some technical issues in the very beginning, and apologies for starting the late program, by the way.
Thank
Well,
you
And
thank
very
you.
much. Bharat.
Thank you. Yeah,
and
thank
in
you very much. You know, one of the fellows that we probably should get hold of is the editor of, publisher of Fiji Times, Rocky Bucks.
okay.
Have you heard of him, Rocky
N-
Bucks?
no, no, I think I've heard about him. Yeah.
Well, how about you, Ashok?
Yeah, I know him.
He's publisher of Fiji Times.
Yes, I know him.
Yeah, he
But
will be good.
he's
Yeah. Isn't
well,
Fiji?
he's the
Isn't Fiji?
publisher of a newspaper, and I
Isn't
don't think
Fiji
he's an
Times?
authority. He's
Yeah.
not an authority on healthcare.
Yeah. So that'll be a bit of a problem. I have some issues with reaching out to people as far as interviews are concerned and making awareness. And my prime concern is making awareness. And anything we put out on this program is not to advocate in people in some other way. This is basically creating awareness. So the little disclaimer is don't take our word of mouth as a truth. It's just basically creating awareness, and we don't hold anybody responsible for anything that is outcome of this program. So
Thank you.
basically, that's all we have to say to them, that this program is only for your entertainment purpose. Number one, number two is for awareness, so that you take something out of it. Well, gentlemen, we'll hopefully call in one day again, and we'll get all those technical difficulties sorted out,
Thank
uncles,
you.
and we
I'm,
wish you
I'm,
all the
I'm,
best,
I'm
both of
going
you.
to buy a new computer.
You don't have to buy a new computer. You've got a computer which is pretty good. It works as sweet as at the age of 83. You're doing it very well, so that's kind of good.
Excellent.
Yes,
Excellent.
and I'm not going to tell people what was going behind the scene in the last 40 minutes. We were struggling and all those, the frustrations. But at the end of the day, it's actually finished, and it's wonderful. It's been
I spent a lot of time trying to prepare for this. Did a lot of research.
yes,
It's
yes,
very
yes,
interesting. It comes with when I did my PhD, it's a dissertation. A lot
yeah,
of research.
yes,
Took me
yes.
here.
So you were happy with what you delivered today there, Uncle Jay? Did you get all your matters
Absolutely.
through? You get all your
No,
matters through, all your
absolutely.
points?
I just feel badly that we wasted because of me.
Oh, no, no, no. We managed to, as long as we managed to get
It's
all your research out.
always a challenge. You don't look back, you look forward.
Great. And yourself, Ashok, did you manage to get everything through there?
Most of it.
Yes, most of
And
it.
I just want to keep repeating that please, everybody who's listening, pass it on.
Pass it on.
Vaccinate, vaccinate, vaccinate.
Vaccinate. Vaccination. You'd be a good advocate. The government should hire you. Look, gentlemen, it's been a pleasure, and it's Saturday here. It's 3:26 p.m. at the moment, and I think yours is a day ahead. Sorry, a day behind. So it's about what time is it? 11 something?
1027.
1027.
Okay, give my regards to your loved ones. Actually, those who have actually helped you guys to get onto the forum. Your son, of course, Mr. Muni, and Auntie
Thank you.
Kobia, Auntie Narayan. Give her, although she's Greek, and give her our regards and thank you for coming,
She'll
and
be
all your
fine.
family and friends, that had supported you into getting into this done. So stay behind, and I'll talk to you before let me finish this feed, and I'll come back. So stay over there, both of you. So stay there for a second. And so, yes, ladies and gentlemen, that was today's feed on COVID, and hopefully you've taken something and from this program, and we intend to bring programs like this with you. No time, you can always, this is always recorded and it goes on the feed, and you can actually watch it live, or if you have time, or otherwise you can share it with your family and friends and watch it afterwards. It still stays there. And if you haven't subscribed, please do subscribe. Upstairs here, it's a like button, and just spread the news to your family and friends. This is of no monetary value. This is just creating awareness and helping you guys and keeping the community intact. Just stay safe with your families and friends. And with that light note, I'd like to say goodbye, good evening, good afternoon, Bula, Namaste, Namaskar, whichever part of the world you're living in. Take care and be safe. And we'll hopefully and get tuned in with me. Tomorrow there's another program and I'll give you more details on that. Ciao for now. All the best for myself. Goodbye.